the top 7 vitamins to strengthen your legs. Imagine waking up with legs that are invigorated, powerful, and solid. No cramping, no muscle weakness, and no danger of falling or losing your balance. Nutrition is essential for preserving independence, confidence, and physical activity. The 7 most powerful vitamins and minerals that will keep your legs strong and unstoppable are unveiled today. These essential nutrients can have a substantial impact on your daily mobility and well-being by improving muscular performance, maintaining bone density, and increasing circulation. This video is for you if you enjoy dancing, going for walks in the park, or simply being self-sufficient. Please let me know where you're coming from today before we start. Please feel free to ask any questions and leave a remark below. Also, remember to enable notifications and click the subscribe button. Together, we can build a stronger, healthier future. Let's begin by mentioning vitamin D. Our bodies naturally alter as we age. Bone density and muscle mass decline, making formerly simple tasks more difficult. Vitamin D deficiency is one of the most commonly overlooked causes of this decline. Brittle bones aren't the only concern. This vitamin is vital for keeping your legs healthy, balanced, and powerful. Let's look at why vitamin D is the most important mineral for leg strength in older persons, and how getting enough of it can help mobility and overall health. Our skin's ability to manufacture vitamin D from sunlight diminishes with age. Even worse, many seniors spend less time outdoors due to lifestyle changes, mobility challenges, or skin damage concerns. What's the outcome? A frequent weakness that gradually weakens muscles, making legs shaky and feeble. Low vitamin D levels have been related to muscle weakness and an increased risk of falls in the elderly, according to research. According to a study published in the Journal of Clinical Endocrinology and Metabolism, seniors with adequate vitamin D levels had stronger muscle fibers, better coordination, and improved balance, making them less likely to have accidents or fractures. People with a deficiency, on the other hand, lost muscle mass at a faster rate, making even simple actions like getting out of a chair or mounting stairs more difficult. Vitamin D is important for more than just bone health and calcium absorption. This supervitamin improves muscle function directly by enhancing protein synthesis and neuromuscular transmission. Consider it a supply of energy for your leg muscles. They struggle to function optimally without it. According to studies, vitamin D is needed for maintaining fast-twitch muscle fibers, which are required for balance and quick reflexes. These fibers help to prevent falls by allowing the legs to react fast when their equilibrium is disturbed. These muscle fibers deteriorate in the absence of adequate vitamin D, increasing the risk of injury and resulting in weaker contractions and slower reaction times. Vitamin D has also been demonstrated to reduce muscular tissue inflammation, which can aid seniors who suffer from chronic leg stiffness and soreness. It may surprise folks who suffer from recurring cramps, stiffness, or unexplained leg pain to learn that increasing vitamin D levels can bring significant relief. Ignoring a vitamin D deficiency can result in a variety of serious health consequences, including weaker legs. The most concerning, fractures and osteoporosis. Brittle bones are prone to cracking due to poor calcium absorption induced by a lack of vitamin D. If a little slip and fall leads to a serious fracture, mobility and freedom may suffer significantly. Vitamin D deficiency has been linked to lower immunity, heart disease, and cognitive decline, in addition to bones and muscles. In addition to having weak legs, seniors who do not get enough vitamin D may be more prone to chronic illnesses, which reduce their quality of life. What is the answer then? The good news is that maintaining optimal vitamin D levels is simple and can have profound impacts. These are the most effective techniques for raising vitamin D levels while also keeping stable, strong legs. Exposure to sunshine. A natural boost can be acquired by just spending 15 to 30 minutes in direct sunlight, preferably in the morning or late afternoon. Maximize absorption by exposing your arms and legs, but use sunscreen sparingly because it can inhibit vitamin D synthesis. Foods rich in vitamin D. Fatty fish, salmon, mackerel, sardines, fortified dairy, egg yolks, and mushrooms can all help boost overall consumption, even if diet alone isn't enough to meet daily requirements. Supplements. Many older people require vitamin D supplements, especially those who spend little time outside. The majority of specialists recommend 800 to 1,000 IU per day for optimal bone and muscle health. However, under medical supervision, higher dosages may be required for persons with severe deficiencies. If you are unsure about your vitamin D levels, a simple blood test may reveal the answer. Because vitamin D deficiency is so crucial in avoiding fractures and falls, many doctors now routinely check for it in elderly patients. 2. Calcium. Seniors are more prone to fractures because they gradually lose bone mass, whereas younger people's bones are still actively repairing. This poses a particularly serious risk to the legs. Stress fractures in the lower limbs, hip fractures, and femur breaks are among the most hazardous injuries that older people can suffer. When bones lack necessary calcium reserves, a minor fall that appeared harmless in youth can result in months of recovery or even permanent loss of mobility. Calcium, on the other hand, serves purposes other than bone strength. It also contributes significantly to muscular contraction. Walking and getting out of a chair both rely on the complex interaction between calcium ions and muscle fibers. Calcium causes muscle contraction, resulting in controlled fluid movement. If you don't receive enough calcium, your muscles may cramp, feel weak, or be unable to create the force needed to maintain stability. This helps to explain why persons with calcium deficiency frequently experience leg cramps, sluggish mobility, and an overall loss in muscle endurance. So, how can you make sure your body is getting enough calcium? Dairy products such as cheese, yogurt, and milk remain excellent sources, but there are alternative options. Leafy greens, bok choy, kale, almonds, tofu, sardines, and fortified plant-based milks are all good sources of calcium. Variety is the key. A diversity of calcium sources in your diet will help you maintain good bone health and absorb calcium consistently. However, calcium from food alone may not be sufficient, especially for persons who have dietary restrictions or absorption issues. This is where calcium supplements can help, especially when combined with vitamin D, which enhances calcium absorption. However, more does not always mean better. Although calcium is required, excessive amounts, particularly from supplements, can result in kidney stones, artery-clogging calcium deposits, and digestive issues. Finding the right balance is crucial. The daily calcium intake for elderly people should be between 1,000 and 1,200 milligrams, preferably from a combination of natural foods and supplements as needed. In addition to eating, calcium's efficacy is dependent on movement. Walking, resistance training, and even light running are examples of weight-bearing activities that stimulate bone remodeling and help transfer calcium to the muscles and bones where it is most needed. Even a healthy calcium diet will not fully strengthen the skeletal system in the absence of activity. Not only can a lack of calcium weaken bones, it denies people the flexibility to move about, engage in their preferred pastimes, and maintain their independence. Calcium is necessary for healthy bones and muscles, which serve as the foundation for a life of mobility, stability, and confidence. 3. B12. Many people are unaware that vitamin B12 is required for neuromuscular function, despite the fact that calcium and protein are commonly mentioned in relation to leg strength. It is in charge of preserving nerve health, ensuring that electrical impulses passing through your spinal cord and into your legs remain accurate and forceful. Your muscles will not get the necessary instructions without it, resulting in weakness, instability, and a gradual loss of motor control. Unsurprisingly, one of the most common symptoms of a B12 deficiency is weary, heavy legs, which are often accompanied by tingling or numbness. Here's the problem, though. Vitamin B12 deficiency is extremely common among the elderly. Vitamin B12 absorption is highly dependent on intestinal function, as opposed to other vitamins, which can be stored in fat or absorbed through a range of foods. To absorb vitamin B12 from food, the body needs enough stomach acid and a particular protein called intrinsic factor. The production of stomach acid decreases with age, and conditions such as acid reflux, gastritis, and even extended antacid use can impair absorption. When combined with the fact that many older individuals unwittingly eat diets low in vitamin B12-rich foods, there is a gradual but apparent loss of this essential ingredient. B12 deficiency has far more serious consequences than simply making you feel weak. Untreated B12 deficiency can result in irreversible nerve damage, impairing reflexes, balance, and coordination. The neurological consequences of a B12 shortage are impacting many elderly people who experience frequent falls, difficulty walking, or a sense that their legs may not function as effectively as they once did. The decrease is absolutely preventable, but it is often so gradual that it is dismissed as a normal part of aging. Fortunately, increasing your B12 levels can considerably increase your mobility and vitality. According to research, seniors who address their insufficiency see demonstrable improvements in leg function, strength, and endurance. However, where does this vital nutrient originate? Vitamin B12 is almost solely found in animal products, as opposed to many other nutrients that can be obtained from plants. Lean meats, fish, eggs, dairy products, and shellfish, particularly clams and liver, are the best sources. B12 fortified foods, such as cereals and plant-based milk, or B12 supplements, become essential for persons who follow a plant-based diet or have absorption concerns. What is the good news? Vitamin B12 is one of the safest vitamins to use as a supplement because excess levels are excreted in urine. Higher dose B12 supplements or occasional injections are beneficial to many older people, especially those who have difficulty absorbing it through food alone. Frequent blood test monitoring can help to ensure adequate levels and prevent the progressive loss of leg function that so frequently occurs after insufficiency. Here's the real lesson, though. Having powerful legs involves more than just physical strength. They focus on synchronization, response time, and nervous system efficiency. Your legs will not react as they should if your nerves are not functioning properly, no matter how much exercise you undertake. As a result, maintaining your B12 levels stable is one of the most underutilized but effective methods to maintain your mobility and quality of life as you age. 4. Magnesium. Magnesium works in the background to ensure that your muscles receive the signals necessary to contract and relax smoothly with each step you take. It is the principal modulator of muscle action. Therefore, it lowers fatigue, enhances endurance, and prevents spasms. Frequent leg cramps at night and restless leg syndrome are two of the most common but poorly understood symptoms of magnesium insufficiency. Many elderly persons experience painful, abrupt leg muscular spasms, particularly at night, which disrupts their sleep and makes it difficult to return to their normal habits. This extends beyond ordinary discomfort. It suggests that the body is having difficulty regulating muscle relaxation. Magnesium is essential for those suffering from muscle tension and involuntary spasms because it reduces overactive nerve signals and keeps muscles from suddenly tensing up. Magnesium, on the other hand, serves purposes other than muscular contraction. It also promotes joint health and bone density. Although calcium is commonly mentioned as a vital mineral for bone health, magnesium is required for calcium to work effectively. This mineral helps manage calcium transit by ensuring that calcium is properly incorporated into bones rather than deposited in soft tissues, which can cause stiffness and joint discomfort. Higher magnesium intake is critical for overall mobility because research has shown that it improves bone strength and reduces the risk of fractures in the elderly. One of the most common reasons for magnesium shortage is the ability of stress, medicines, and poor dietary habits to rapidly deplete magnesium. Older people take a variety of drugs that lower their magnesium levels, including proton pump inhibitors, diuretics, and various blood pressure medications. When paired with diets low in magnesium-rich foods, the result is a general deficit that gradually erodes flexibility, strength, and endurance. As a result, many seniors gradually lose their stamina, walking shorter distances, rising stairs more slowly, and becoming weary after doing routine duties. It's a shortage of the necessary nutrients to support performance, not only aging. Restoring magnesium levels can improve leg health almost immediately by reducing cramps, increasing vigor, and restoring mobility. Whole grains, legumes, leafy greens, nuts, and seeds are the best dietary sources of magnesium. Magnesium-rich foods include avocados, spinach, black beans, pumpkin seeds, and almonds, which help to maintain bone and muscle health naturally. Magnesium supplements, particularly magnesium citrate or magnesium glycinate, which are more easily absorbed by the body, can be an effective option for people who struggle to get enough through diet alone. Restoring magnesium levels produces a spectacular turnaround. Seniors' legs, which were previously sluggish and lethargic, respond with renewed vitality. People who have had frequent muscle cramps or stiffness report feeling better, allowing them to move more freely and sleep better. Magnesium helps manage the neuromuscular connections that allow for consistent movement, so balance and coordination improve. Aindavadu potassium. Imagine getting out of bed in the morning and having a calf cramp immediately. Does this sound familiar? Muscle cramps are one of the most common indicators of low potassium levels. This is because potassium regulates fluids both within and outside of muscle cells, acting as an important regulator of muscular action. When potassium levels drop too low, muscles spasm involuntarily, resulting in severe cramps, especially in the legs. Furthermore, these cramps may be more than just an inconvenience for the elderly, who may already have reduced muscle mass or circulation. These could be incapacitating. However, cramping muscles are merely the beginning. Have you ever felt your legs tremble after standing for a long time? Perhaps you have noticed that your walk has gotten stiffer. Potassium is in charge of transmitting information from neurons to muscles, allowing for fluid-controlled motions. Low levels can significantly increase your risk of falling because they hinder the brain-leg muscles' ability to communicate with one another, causing shakiness, weakness, or even difficulty elevating your feet correctly. Let's be honest, preventing falls is critical for the elderly. Potassium serves an unexpected purpose in maintaining strong bones in addition to muscles. It helps the body neutralize acids, which can impair bone density over time. According to research, a potassium-rich diet may reduce the rate of bone loss, minimizing the risk of osteoporosis, and preserving the structural integrity of the legs. Potassium is important not only for muscular function, but also for ensuring that the muscles and bones in your legs work together. The big question now: how do you ensure that you get enough potassium to support your legs? Fortunately, nature has provided us with an abundance of delicious potassium-rich foods. Although bananas may be the first object that comes to mind, they are merely the beginning. Oranges, beans, avocados, spinach, and sweet potatoes are all good sources of potassium. Even a plain baked potato with skin contains more potassium than a banana. To ensure that your muscles and bones are properly fed, include a variety of these foods in your regular diet. Supplements may appear to be a straightforward option for persons who struggle to obtain potassium from food alone. What is your exact potassium requirement? Adults should eat 2,600 milligrams for women and 3,400 milligrams for males every day. Typically, a well-balanced diet rich in fruits, vegetables, and legumes can help you reach this target. People with conditions such as kidney disease or high blood pressure, which affect potassium levels, should monitor their intake and visit a doctor to determine the proper amount. 6. Vitamin K, calcium, and vitamin D are usually mentioned as vitamins required for healthy bones. However, these minerals cannot work properly without vitamin K. In contrast to calcium buildup in soft tissues or arteries, which can cause stiffness, poor circulation, and even cardiovascular disease, vitamin K is an essential component that ensures calcium is deposited in bones where it belongs. To put it another way, vitamin K acts as a traffic controller, guiding calcium to the right places while also maintaining the structural integrity and mobility of your legs. This is especially crucial for seniors. According to research, persons who drink more vitamin K have stronger bones, a lower risk of fractures, and overall better bone health than those who consume less. This is because vitamin K activates osteocalcin, a protein that binds calcium to the bone matrix, thereby boosting bone density and fracture resistance. The benefits of vitamin K do not stop there. It is also an essential nutrient for maintaining healthy muscles and joints. Many people do not understand that strong bones alone are insufficient for healthy legs. They also require flexible joints and correctly functioning muscles. Vitamin K has been shown to reduce joint inflammation, which can slow the progression of osteoarthritis and relieve knee stiffness, a common illness among the elderly. Vitamin K may be the missing mineral that relieves pain and allows you to move freely if your knees hurt when you move or feel stiff after sitting for an extended period of time. Weakened leg muscles are usually linked to poor balance, difficulty walking, and an increased chance of falling. According to recent research, vitamin K improves muscle coordination and strength, particularly in older people. It accomplishes this by regulating the quantity of calcium in muscle cells, ensuring proper contractions, and avoiding irregular movements that could cause instability. Brussels sprouts, collard greens, spinach, kale, and Swiss chard are excellent providers of vitamin K1, the most common kind found in plants. However, fermented foods such as natto, fermented soybeans, aged cheeses, and some animal products such as liver and egg yolks contain vitamin K2, a more potent form of the vitamin. K2 is particularly beneficial since it is active in the body for a longer amount of time and has a stronger effect on directing calcium to bones rather than arteries. Increased eating of fermented foods and green vegetables is the most effective strategy to naturally boost your vitamin K levels. Even something as basic as serving sautéed spinach with your lunch or incorporating kale into your daily smoothie can have a huge impact. However, supplementation may be a realistic option for people who have difficulty absorbing vitamin K from food, particularly those who have digestive disorders or are taking antibiotics for a lengthy period of time. Prudence, however, is vital. Because vitamin K has a role in blood clotting and can interact with blood thinners such as warfarin, you should consult with a doctor before increasing your intake. 7. Vitamin B6. Most people are unaware of how vitamin B6, often known as pyridoxine, influences muscle function and leg strength. A lot of nutrients influence mobility, but B6 is particularly important for nerve health, muscle regeneration, and ensuring that the body uses protein efficiently in order to grow and maintain muscle mass. Without it, simple acts like getting out of a chair or going upstairs may feel unduly difficult, and even the strongest muscles can gradually degrade. The importance of vitamin B6 in nerve transmission and coordination is one of its most unappreciated characteristics. Low B6 levels can cause these signals to be sluggish or mistaken, resulting in tingling, numbness, and even an unsteady gait. These symptoms are commonly mistaken by older people as aging-related muscle loss, when in reality, their bodies are simply not receiving enough nutrients to support good neuromuscular function. Vitamin B6 is also essential for minimizing muscle fatigue caused by inflammation. B6 makes the legs more resilient and flexible by regulating the body's inflammatory responses, reducing muscular soreness. If you've been suffering from chronic stiffness or slow recovery after exercise, increasing your vitamin B6 intake could be the game changer. Vitamin B6 is required for the formation of red blood cells as well as muscle function. These cells supply the body with oxygen, which fuels muscles and gives them the stamina needed for sustained activity. Lower hemoglobin levels due to a B6 deficiency may hinder your muscles from receiving the oxygen they require, resulting in early fatigue, heaviness, and diminished stamina. If you've ever felt unusually weary after going for a quick stroll or engaging in light physical exercise, your body may be alerting you that you need extra B6. What is the source of this important vitamin? Fortunately, B6 is abundant in a variety of pleasant and readily available foods. Good sources include poultry, fish, especially salmon and tuna, bananas, potatoes, chickpeas, and fortified cereals. By incorporating these foods into your normal diet, you can naturally increase your B6 levels, which can improve muscle strength and nerve function. B6 supplementation may be required to achieve appropriate levels in those with dietary restrictions, poor nutritional absorption, or digestive issues. Vitamin B6 intake recommendations vary by age and gender, with older people typically requiring 1.5 milligrams for women and 1.7 milligrams for men each day. Although receiving B6 from food is generally safe, taking high-dose tablets in excess should be done with caution because prolonged use may cause nerve damage. The best course of action is to focus on eating a balanced diet rich in B6, which will give a constant supply while avoiding unnecessary dangers. Please remember to click the like button if you found this video informative. It definitely helps us to provide you with more useful articles. Please leave a comment below with any thoughts, questions, or suggestions for the next topic we should cover. We like hearing from you. To guarantee you never miss out on our most recent health tips and insights, click the subscribe button and enable notifications. See you in a future video, and stay informed and well.